Next up, we have our first panel discussion on power of healthcare data, a simpler and more digital workflow. It is indeed an honor for me to introduce our renowned contributors. Let's start with our eminent moderator, Dr. Dari Alhuwail, Associate Professor, Information Science Department, Kuwait University. Ms. Hana Ibrahim Abu Sharib, Corporate Senior Nursing Informatics Officer, Abu Dhabi Health Services Company, SEHA. Dr. Abdulwahhab Alshammari, Assistant Professor, Health Informatics Department, King Saud bin Abdulaziz University for Health Sciences, Saudi Arabia. Dr. Nasseer A Masoodi, Vice Chair Acting, Clinical Informatics Department of Medicine, Hamad Medical Corporation. Dr. Najeeb Al-Shorbaji, President, Middle East and North Africa Association of Health Informatics President, eHealth Development Association, Jordan. Engineer Fazal Ashur, Simulation and Innovation Engineer, Ministry of National Guard, Health Affairs. Over to you, Dr. Dari, to moderate this wonderful panel.
Thank you, Satish, and it's a great honor to be among, really, I would call them the leaders and stars, if you will, in the region that, are leading, many of the fantastic work. So, as Satish was saying, we need to, we're going to be discussing the power of, healthcare data, right? And seeing how this, how this plays out. And I think we had, a wonderful and fantastic introduction. Hopefully we're going to have, a fruitful discussion amongst all our panelists. And I would like to, first start maybe with Dr. Abdulwahhab Alshammari. Dr. Abdulwahhab, if you can talk to us, how can data and healthcare data really connect to better outcomes, better workflows, and better care?
Bismillah ar-Rahim. First of all, thank you all for having to join this wonderful, brilliant minds conference. And hopefully we can collaborate more in the future. So thank you for that question, Dr. Dari. The question is how, as you said, can more data and healthcare connect to better outcomes or workflows or care? So in the last 2 decades, we have seen significant advances in the production and collection of data, as well as our ability to analyze and understand how this new information effectively. So advances technology are helping every industry become more efficient and productive, and healthcare is no exception with all this technology around. So a sweeping transformation is happening right now in healthcare with all these advances, with all this technology, such as, for example, I gotta give you like one short or one simple example, as for example, remote patient monitoring, or what they call Internet of Things, or with this wearables. So these, like, examples. Also big data, been around for like about 2 decades or more. All this will be flowing the way for more data-driven approaches to patient care. So how a healthcare organization can collect and manage more accurate and timely data will be determined its ability and how to improve the workflow, how to improve the quality, how to improve the delivery of to achieve a better patient outcomes and quality. So, for example, with the cell phones, with the smartphones, with the cellular remote monitoring technology or wearables of Internet of Things, has a great promises to have like a healthier planet by tracking, storing, analyzing massive amounts of patient data in real time. All this will be enabling more convenient, more accessible, and more affordable healthcare for all. More data with the right technology, with the right tools, with the right people, will allow us to detect, will allow us to turn the high volume of data into actionable knowledge for precision medicine, as example, for decision makers, for policy making, all that to improve the patient's care. So, for example, now the use of more data or big data in healthcare is already offering solutions for improving patient's care and generating value in the healthcare organization and to reduce costs. So big data has a great potential to change the healthcare landscape and we cannot, forget about that. It's happening for us every day. We see live examples on that. So it can save people's lives by preventing diseases, forecasting medical outcomes, reducing medical errors, reducing the health risk, reducing the complications or the hospitalization or length of stay in hospitals. Also helps us to reduce resources waste and improve the cost of care. So all that will be on the other side, will be increasing efficiency, will be improving the quality of healthcare, will give us like a better plans to how to manage our resources. So this approach requires, however, that all the relevant stakeholders collaborate and adopt the design and performance of their system. As Dr. Dari mentioned in his previous or in his presentation, it's not an easy task to do all that at once. So it's a challenging task, exactly. So we, like stakeholders, they sit together, they should sit together to must and build technologies infrastructure to house and how to converge this massive value of healthcare data. So we need policy making, we need standardization and capture, we need to store and how to exchange the accurate healthcare data and how to touch on the interoperability. Privacy, security, confidentiality. There's so many things to mention. So just to give more time for my colleagues, so I will stop here to answer this question. Thank you all.
Great, thank you, Dr. Abdulwahhab. And now moving on to Dr. Nasseer, can you please comment on the growing importance of utilizing data, analytics, artificial intelligence in the future of healthcare, and maybe reflect on that, on some of the work that's being done at your workplace?
Thank you. Thank you for this opportunity to be part of this eminent panel. And I think it goes without saying that data is powerful, right? By this time, all of us have realized, whether you are in healthcare or in any kind of field, data is powerful. The famous quote by Edward Demings that immortalized the power of data when it comes to the science of healthcare practice, that in God we trust, all others must bring data. I don't think there is any other statement that makes it as simple, but as precise. So there is growing importance of utilizing data, analytics, and artificial intelligence in the future of healthcare, and proactively keeping our communities healthy, including population health management and chronic disease management. As more and more data becomes available from numerous sources, electronic health records, our insurance claims, wearable medical devices, social media, even patients themselves, right? And so many other sources, analytics can increasingly help detect patterns in information, and that's really what's important. This delivers actionable insight to predict and conceive alternatives that might not be otherwise obvious, as Dr. Abdulwahhab was highlighting in his previous comments, right? Using the software and AI programs to appropriately analyze the data helps us to deliver meaningful analytics across all the points of care. Whether you are taking care of that patient in a primary care setting, secondary, tertiary, outpatient, inpatient, really doesn't matter. But once we have these data sets, that really can change how we practice and also change our operations. So using these, software and AI programs to appropriately analyze the data helps us to deliver meaningful, improvements. And this also, analytics helps us to drive cost and waste out while continually improving on quality and safety. I think what also becomes very important along with the data concept is the quality and accuracy and completeness of the organization's data. I think they are of the utmost importance to cultivate an information-rich organization. This also requires, from an organization that really wants to get, maximum out of the data, that they have to have a robust data governance and security strategies, because it does come with its own pitfalls once you have all this powerful information available, right? So that the data sets are the data assets, actually, I would call it, because it becomes an asset now, a huge asset. So these data assets are cleansed, they are managed, they are stored, retrieved, maintained, utilized, shared, and protected throughout the enterprise. And that, kind of takes us into a very different, playing field, and where some rules are set and some are not set yet. So that becomes very important in that sense. So implementation of AI analytics guided projects can really provide healthcare organizations with actionable insights, both at a population health as well as risk management. Healthcare AI has the potential to take over the time-consuming task of data input, so the clinicians can focus on providing the care to the patients. The AI technology can also be useful to improve the physician workflows, while simultaneously contributing to the burnout relief and prevention, which is one of the drawbacks of technology, is really the end user burnout. So we have AI-enabled technology options that can help clinicians to document all the discrete clinical data, place orders, complete notes, capture charges. That is also very important. You do want to get return on investment. We have microphone arrays, sensors, videos, other inputs that are being designed to observe the patient-provider interactions, transcribe encounters, correlate them with the sensor data, and all these key clinical concepts can be really extracted, transcribed, and the nonverbal cues derived from the sensor data can provide supplemental information to aid in so many other things. So in other words, just to end up with, at this time, how we as clinicians interact with our EMRs will rapidly be transformed in coming years because of the innovations.
Great, fantastic, Doctor. Thank you for these, valuable insights. Now, it goes without saying, right? There are many use cases, and I think we've proved the point. Yet, however, we need to also realize that there are certain challenges. And now, Dr. Najeeb, if we can ask you, right, if you can highlight, some of the basic issues related to data collection challenges within the region. What's the situation right now, and how do we go from there? Please, the floor is yours.
Thank you. Thank you very much indeed, Dr. Dari, and many thanks for the organizers of this event and the panel colleagues. A number of challenges actually exist, and I don't want to elaborate too much on that, but I think the very three words that you said, Dr. Dari, the new oil, describing data, is actually, it's the new oil. Now that new oil has to be used, has to be purified, and it has to exist. In God we trust, yes, we do, as they say in the United States of America, and they have that written on their dollar notes. And in data we do trust, but that data does not exist in many countries, unfortunately. So one of the big challenges actually that we are facing is the lack of data in the healthcare center, the healthcare sector. We do have a lot of data, but we don't have it organized. We don't have it actually in the quality that we would like to use for decision and policy making in the countries. So one of the biggest challenges, which one can speak a lot actually on, is the dear and the scarcity of good quality data in healthcare sector in the region, which simply means that we do use the data and we do collect the data in different formats, including the graphic format, including text format, including voice recognition, including voice recording and all that, but very little of that is being used. And last night was just an example. I was in an emergency hospital with a friend actually, and over the last 24 hours, 3 times they did take actually heart graphs, and so every time that you need to do that, they would ask for exactly the same thing, which simply means that they do not use the data that has been collected by another colleague or another hospital or another institution. Now, the quality, the presence of data is one big challenge, which I do encourage, and I would like to ask all our institutions, healthcare institutions, to care about data. Data is a real asset. It is actually the fuel of the new thinking, and it is actually the basis for whatever decision we want to make. Without the data, it will be like they say in Tunis or in the North African region. It's like actually going into the dark. Going into the dark is you may fall in the trap, you may fall, you may face a wall, you may just end up somewhere else. So we don't want actually the healthcare system to be misled by lack of data. So important to include data in the mechanism by which they do the diagnosis and the treatment and the health education and all that. The current trend about misinformation that we have seen during the COVID, and it is still going on, it's about actually misuse of health data. So this is one thing. The other thing is when data is available, very little of it is actually of high quality. And that has been highlighted by Dr. Nasser in terms of quality of data. We do not get the quality that we would like to have. The other thing which is important, actually, we don't have the governance that will control the data collection. Especially the ethical part. Maybe in legal parts, we are more or less covered, but we are not covered fully, actually. But when it comes to ethical, we do actually have a lot of lessons about the security, about confidentiality, about the privacy of data. We do leave the data unattended on computers. We do leave that in medical records. We do leave that to the doctors to talk about the cases that they have, which all is wrong. Because that data is actually to be secured, and it has to be very safely stored, and it has to be stored in a place where there is high level security to protect it from invasion, from misuse, from penetration, from all that. So when we talk about health data, actually we are talking about the basic things. Of course, data can be converted into information, and information to knowledge, and the hierarchy is very well known. But it all starts actually with data. With data, if we don't have that, if we don't have quality of that, if we don't have enough security about that, which will result in much more important thing, which is the trust between the patient and the healthcare provider. If that trust is broken, if that trust is actually gone, then you do not expect the patient to sort of come forward and ask for advice, simply because he or she does not trust that individual. So trust is based on the quality of data, is based on the data that you are actually collecting about people, and the way that you protect it, and the way that you use it. So from that perspective, I don't want to sort of go ahead and talk about the different aspects of data collection and data management, but three things that are really important. Number one, the quality of data, or the data presence itself, the quality of data, and the confidentiality, privacy, the governance that is actually surrounding data. I stop here, and I'm sure there are many comments and many people that would like to add to that, because on data, yes, we do trust, yes, we do like, but we would like it to be there. We would like to enhance its presence, and we would like to make sure that people actually contribute data. That is a huge problem. I have seen it a number of times. People you ask the patient about their wellness, about their environment, about their conditions, and they tell you half of the story or no story that the physician can actually make a better diagnosis and a better treatment plan for what they do, which simply means that we don't either don't trust or we don't know the value of what we are contributing to the healthcare system. Back to you.
Thank you, Dr. Najeeb. So now knowing that we have some of these challenges, and hopefully we'd like to invite Engineer Faisal, right, to talk to us how the use of modeling, simulation, and visualization is useful to the hospital and its operations. I think Dr. Najeeb highlighted some of these issues, right, and some of these challenges. But if we wanted to put them in action, what would we do, and how would modeling, simulation, and visualization help us? Engineer Faisal, please go ahead.
Thank you very much. So mostly it's about the innovation idea, and modeling, simulation, and other innovation idea. It's really an absurd idea that in the healthcare system was one of the most difficult systems to apply to, because we're dealing with a human being. But as Einstein said once, if the idea is not absurd, there is no hope for it. And this is the most important thing, is modeling and simulation, and mainly concerned about the waste management, which most in the hospital is time. In the National Guard, for example, we care about the time and the waiting list. And we deeply working with the workflow system and how the patient work, how the whole hospital works. So if we adjust something in real life, and in day 50 or 60, something happen, it will affect the waiting list. So what we do is we model, simulate, and visualize the system in a simulation system and run it for 3 years, for example, 8 hours a day, and check the outcome. It's being validated, of course, and verified up to 98%. If we like the outcome, it's match what's the end user need, then we can implement it in real life. Most of these is related to innovation, and we apply also virtual reality, for example, or augmented reality. All of these wasn't invented in the healthcare system. So what we do is we reshape, redesign based on the need. There is a need for innovation. There is a need of specific tools that we needed. For example, in the National Guard, we wanted to reduce the waiting list. We have a long waiting list up to 3 years for the day surgery unit. We have an active military that they need immediate assist and their family, and the whole National Guard affiliation, they cannot wait 3 years. So we need to adjust this. To adjust it, we do the modeling and simulation. Also, we want to reduce the time for some of the operation to eliminate sedation. So we use virtual reality to do hypnosis for the pediatric oncology cases, radiotherapy. We reduced the time from 1 hour, 30 minutes to 12 minutes. So all of these tools wasn't invented in the healthcare system. What we do actually, we saw a need. We saw that we need to implement these technology and these tools, modeling and simulation, and is a system simulation actually, use it to enhance the current system. Because we dealt with one of the most difficult and advanced hospital in the region, which is the National Guard. We have the brilliant mind, we have a military physician. So we have mind that we can actually, we have to understand and speak the same language as they do. So we did that, but at the same time, to implement and change what's currently happening is difficult. So what we do mostly, we enhance the current system. We don't change it. This is exactly what modeling and simulation do. It just enhances the system. We don't change the system. We don't change the workflow. We enhance what you're doing in a better way.
Great, fantastic. Thank you, Engineer Faisal. Again, there is always, and this is one fantastic, if you will, use case or use of health data or data in general, and especially if we address the challenges that were highlighted by Dr. Najeeb. And now I'd like to move to Dr. Hana, to talk to us about a little bit about the importance of collaboration and how could we encourage the healthcare providers to collect and contribute more and better health data to allow the entire care team, as well as perhaps maybe even the consumers or the patients, to get a better picture and support better evidence-based decision making. So please, Dr. Hana.
Assalamu alaikum. Thank you, Dr. Dari. It's my pleasure to be with you all team. Just to introduce myself, I'm from nursing background and I got engaged in the health informatics for the last 10 years. And I totally understand that we need to have a full collaboration from all the disciplines once we talk about the healthcare sector, because we are all involved in the care of the patient. Now, if we want to get the buy-in from the healthcare providers, we need first to highlight the desired outcome or the why that is required for us to acquire this scope, which is the digital health. We need to tell them that it's going to improve the patient safety and it's going to have better healing or well-being for outcomes for the patient. It's going to reduce the cost variation of service delivery, and it's going to standardize service quality as well as increasing the finance control, which will eventually lead to improving financial return of investment. This is one thing that we will justify the buy-in from different disciplines. The second part is that we need to build the capacity of the workforce to be digitally literate. And in that terms, I need to have a clear career ladder for proficiency with an outline job description, starting from being basic health informatics into advanced and into proficient level. And that should be adopted within the healthcare system by the HR and the IT within the clinical team, so that it can be enabling the people to practice more within the healthcare system in a right way. And once we are talking about the healthcare system, we're looking now at a bigger picture, which is creating an ecosystem for digital health. And how this is being done simply by, we need to have an enterprise-wide strategy, and we need to have a change-ready culture that everybody is willing to contribute, and they know that they have their portion of digital literacy that they are aware of. We need to engage the workforce, that it is the accountability of everyone to learn their part of digital literacy, although that we are having the health informatics with refined jobs and functionality serving the purpose of providing the accurate data as mentioned earlier. But yet everybody is accountable by simply entering the data, the accurate data. That would help out, and that will be the accountability as mentioned by Dr. Najeeb. Even from ethical perspective, clean data would actually generate a clean knowledge or information and knowledge. And then we need to empower the leaders to drive this transformation within the ecosystem of the organization. And the last part is to have it integrated deeply into the organization strategy. So now everybody is knowing that this is part of our practice, and it's just like the quality being introduced long time in the healthcare system. Digital health is now involved in everything, and everybody in the healthcare needs to know a certain portion or certain amount of knowledge that keep them going and offering safe practice within the organization.
Great, fantastic. Thank you. Thank you, Dr. Hana, for sharing these valuable insights. So I'm looking at my chat. I do not see any questions from the audience. So I'm going to take the liberty to use the remaining time, unless questions come in, to ask and poke my panel members, right, with certain questions. But I'll pose the questions to you all. And those that wish to answer, maybe just, we'll take you by order, raise your hands, and we'll organize it this way. But, for the interest of time, I'd like to ask you to limit your answers to at least a minute, just so we can accommodate everybody in these questions. So my first question would be, that we've talked about the role and the importance of healthcare data and why it's important to model it. We talked about, the engagement of various stakeholders, and some of the solutions. We talked about some of the technologies and some of the use cases that, have been, excellent in this. But, and I think we touched, although I'd like to say lightly, when it comes to cybersecurity and ethics, right? So if I were to tell all my panel members, right, that what are the most top 2 concerns or top 2 projects, top 2 initiatives as it relates to either cybersecurity or ethical handling of data, what would those two projects or if you will, things that you would do? And imagine that now we're speaking to our heads of governments. Imagine that we're speaking to our policymakers, right? So what are the most two things that you'd like to focus on? And obviously this is from your own perspective and from your own, context. So let's put it that way. Anybody would like to start?
Yeah, I would like to start.
Sure. Go ahead, Dr. Hana, please.
So in that terms, I would say the most important thing which we were faced when we are building the awareness about digital literacy, about the healthcare team, they are not aware that, or they do not know that they should know some part of information security parts, and they don't know what is phishing or malware or all these IT related items. They think it's related to IT and it's the IT job. It's not their job. They don't have an ownership for that. So they need to be looking, we need to increase the awareness among our team, and it was part of our orientation in digital literacy about rules related to information security and confidentiality and their accountability for that, where they should not accept any abnormal or non-confident or non-credible emails that's received in this email. This is as a starting point, I would say, to verify the accountability at the level of the end user.
Sure. So we need to get or create training programs and make sure that our clinicians are our workforce, generally speaking, that they're digitally ready to fight this. Dr. Najeeb, I think you had your hands up.
Yeah, in addition to what Dr. Hana has said, actually, many or most of the breaches of security in health does not come actually from outside. They come from inside, which simply means that you need, yes, I do confirm that you need to educate people about the security and about how to keep the confidentiality of the health data that they have, but also important to make sure that there is a legal framework that people are complying with that, so that they know they will be punished, either reprimanded or password taken away or whatever is that. We don't want actually that the patient himself or herself to go to the court to say that my data has been around and people are doing this and that. So this is one. The other thing which is extremely important, the ethical part of the data confidentiality or privacy or personalization. It's really important to make sure that we do have the enough code of conduct. We do have enough guidance to make people actually feel that they are comfortable, that their data is being protected, and that there is the ethical part that is related to their data confidentiality, privacy, and personalization. Otherwise, we will face a situation where people do not actually believe, they do not behave in a way that they want to say whatever they want to their physician and to their physician to record the data on the computer. And of course, the computer and telehealth, in particular telehealth, because it's the data travels between 2 points and a number of people having access to that, including engineers, including social scientists, including the physicians, and so many other people on the two sides of the telehealth service. That makes data more vulnerable. That makes data more actually exposed to more number of people. So we need to ensure that this data is being protected, not protected only by the law, but also by the ethics. And ethics is something that people do believe in. If I am, God forbid, not ethical or wanting to chat around the disease of somebody, one can do that. And we want to make sure that the ethical part is actually fully covered, and that there is enough education, there is enough code of conduct, and there is enough, of course, legal and digital security that protects the data. Thank you.
Sure. Thank you, Dr. Najeeb. Dr. Nasseer, and then we're going to go to Dr. Abdulwahhab.
So just want to add on to the comments that are already made by our colleagues. When you look at any healthcare project, it typically has, in general, 3 components. You have the patient component, you have the provider component, and then you have the others that could be the healthcare, your admins, or the policymakers, or your government and insurance policies, and so many others, right? So, my colleagues commented on some of the things that really fall within the providers and, their interest in data security and these things. I think this also falls huge on the healthcare organization. Take this as part of their major incident planning, especially if you are a big, this is something that you have to do on a regular basis. You have to have a command center, right? It is not only about data, it is also about the safety of the patients and the providers. There is critical information that can get leaked, that can put people's life at risk, or that can stigmatize people if that information is leaked, especially if it is your fellow colleague working with you. So many things happen at the, as our respected panelist, Mr. Najeeb was saying, a lot of these issues happen within, and sometimes within, you may know, oh, that physician's mother has dementia or something like that. It puts a huge, issue in terms, even in your working environment. So having a plan, data security plan, both, a cyber security as well as internal protection plans, they are very important. They should be part of any digitization project. And depending upon how big your projects are, you have to scale it up accordingly. You have to have a command center. You have to have, milestones or policies, what we do immediately within 24 hours, within a week, how kind of we staff it, equipments, what's our recovery plan, what happens if the system during this time doesn't work, how do we go back to the pen paper thing? So all of those things really have to be thought about, but this becomes a crucial part of the whole project.
Yeah, absolutely. Thank you. Thank you, Dr. Nasseer. Dr. Abdulwahhab, please go ahead.
I would like to build on what, for example, Dr. Nasseer said about the patient safety. Also, as Ms. Hana said about how we're going to do the training and teaching, how we're going to involve more stakeholders. And also there's also on what Engineer Faisal said. And by the way, he's one of my previous students and he's a brilliant mind. And I'm happy to have him as a colleague now. So I would build on very important things he mentioned that usually we go and try to enhance our systems, but actually we need to go and think out of the box. So sometimes we need to design a new generation of EHR. So I would like to build on that. Now, we need to accept that with the expansion of the technology, with the expansion of the Internet of Things and patient remote monitoring devices, it's feasible that physicians in the near future will be faced with terabytes of data coming to their system, coming to their clinics, and how they can deal with that. If you got monitoring their heart rate, blood sugar, any variety of factors. So gaining that insights from such large quantity of data, it's impossible to be expected from the patients. So in order to solve that problem of exploding numbers of tests and results, EHRs will need to be extended from being simply like a repository or simply being a record of patient-physician interaction and digital folders to an EHR that helps with diagnostic, with monitoring aids. So designing what they call the next generation of EHR requires, again, massive collaboration, and that's, again, touch with what Dr. Najeeb mentioned about the data, the security, how to deal with it, also with Dr. Nasseer, patient safety, and all of that. So all these stakeholders, and when we talk about stakeholders, with healthcare providers, patients, insurance companies, any association, government agencies, also. So they all require to need and sit and have that in mind that we need to design a new generations around the AI, around the technology, so that help us how to improve in outcomes. And again, we need to build it around that a new culture, what they call patient safety as a culture, as a value for us. So that's when we start protecting patients' data. That's start dealing with confidentiality or security. So changing the culture itself with applying a new generation, I think that these two components will help us a lot to become with
Sure.
the speed of how things are moving fast.
Sure.
And that's all. Thank you.
Thank you, Dr. Abdulwahhab. And speaking of change, right? And speaking of all these challenges, probably going towards the end of this panel, I'd like to ask Engineer Faisal, right? And this also goes in line with one of the questions that we got from one of our attendees, right? But if we're talking about innovation and the use of innovation in the healthcare industry, right? We talked about that the data we collect could enhance our systems, our workflows, could potentially even introduce changes, right? So if you can elaborate a little bit about the use of innovation in the healthcare industry, and perhaps maybe shed light on some of the top strategies, right, that we could use to introduce these innovations to the healthcare system, and how can we leverage that? Please, Engineer Faisal.
Thank you very much. So,
yes, we can hear you.
failed to start. Something happened.
We can still hear you, Engineer Faisal.
Yeah.
Go ahead.
Okay. So, well, the first thing is that innovation is to improve our ability to meet the public and personal healthcare need. And innovation in general, it's either to enhance current system or even to produce a new idea for the system. But the most important thing is in the healthcare system, you're dealing with the human being, so you cannot actually implement any idea just as an idea. It has to be a useful idea, or even something that enhance the patient quality of life, either the psychological aspect, patient safety, all of these most important aspects related to the healthcare system. The thing is, in my own experience in the hospital, is to implement these technology and these idea. Sometimes it's difficult because, I mean, I'll give you a simple example. One of the physicians, he told me while I was doing implementing the virtual reality to eliminate patient sedation for the pediatric, and he told me, son, with all due respect, I have been doing this before you even born. So who are you to tell me what to do? And he has a point, because it makes sense, because I'm dealing with an intelligent mind. At the same time, I need to understand and speak the same language as a physician. And as an engineer myself, I had to study a lot. And even I took the master with the Professor Abdulwahhab, and to speak the same language as a physician and understand exactly what they need. And this is one of the most important aspects in the healthcare system, because, for example, the telehealth or the virtual reality, once we were trying to implement this technology, we had a lot of resistance, even though it's an innovative idea, but we forgot about to expand what is the useful of this technology to them as a physician and as to their patient. So explain all of these and explain the technology, and because some of the physician does not have not an idea, but they're not really tech savvy about this. They're not really up to date with technology. So we cannot blame them. At the same time, we need to understand how to reach to them and explain, well, these technology, telehealth, will be useful. Once we implement the telehealth in the national regard, the physician acceptance of the telehealth was 75%. After we did a lot of education, training, enhance the system, and make it user-friendly, the percentage raised up to 93%, which is really significant for us, because now we can explain, now they know what this technology is. And I'm sorry, there is some problem with the cameras.
That's absolutely fine. I think we're going now really towards the end of our panel, and I'll ask you really this question to all the panel members. And I apologize, but I'm going to squeeze you, because I'm going to ask you to give me one word, right? Just one word, only one word. You cannot use more than one word, right? To end the panel. And just to give you an example, right? I'll be using the word collaborate. So that would be my final word. So let's go, Dr. Hana, what's your word?
Ethical.
Ethical. Dr. Najeeb?
My word is collaboration and integration. Integration.
You choose two words, integration. Okay, we'll take that. Dr. Nasseer?
Value.
Value, Dr. Abdulwahhab.
Culture.
Culture, Engineer Faisal.
Innovation.
Innovation. With this, I'd like to wrap up the discussion panel because I know the moderator or the organizers are going to be holding me accountable. We finished on time. I really, really thank you all for the fantastic opportunity to having led this panel. It was extremely easy. It was an extreme pleasure. Thank you very much.
Thank you. Thank you, everyone.
Thank you.
Thanks.
What a
Thank you.
wonderful and interactive panel. Thank you very much to our eminent panel members, Hana, Dr. Abdulwahhab, Dr. Nasseer, Dr. Najeeb, Engineer Faisal, and our panel moderator, Dr. Dari, for the very informative panel discussion around power of healthcare data, a simpler and more digital workflow. Thank you once again and for giving us your precious time for the summit. I wish you all a lovely day ahead.
Same to you all. Bye-bye.
Thank you.
Thanks all.